Hello and welcome to this edition of the SSAT Mentor of the Month series. My name is Young Hong and I'm the Assistant Professor of Surgery at Cooper University Hospital, and I have the honor and privilege of interviewing Dr. Kelly McMasters at University of Louisville. He needs no introductions, as everyone knows his accomplishments, but he is the Ben A. Reid Senior MD Chair and Professor at the University of Louisville. He is the current editor-in-chief of the Annals of Surgical Oncology, with numerous past presidency of the Southern Surgical Association, Western Surgical Association, Society of Surgical Oncology, Southeastern Surgical Congress, and the Society of Surgical Chairs. He is the principal investigator of his basic science lab, which has numerous NIH R01 funding and has numerous clinical trials, including the iconic Sunbelt melanoma trial, where he was the primary investigator. He has over 476 publications and nearly 200 lecture series. And, my introduction does not do justice to his numerous accomplishments. And I wanted to welcome him to this month's Mentor of the Month series. And thank you, Dr. McMasters, for your time and your dedication to the trainees. And this will be an immense resource for those who can't talk to you every day. So I was gonna ask you some questions that some of our mentees can benefit from, and touch on the advice on mentorship, advice on training and job search, and some life lessons that I think that you have many that you can share some of those with the audience today. So again, thank you, Dr. McMasters, and I welcome you to this month's video. First question is, as you look back on your career, how has mentorship in your past affected your surgical success today?
Well, first, it's great to see you again, Young. I know you're doing well, and um, I'm sorry this is a virtual interview, but I look forward to seeing you again in person.
Yes, sir.
So, what have my mentors mean to me? Mentorship in academic surgery is everything. So, I trained with Hiram Polk and David Richardson and others at the University of Louisville. I spent a couple of years in Houston and for fellowship, and came back, and it's the only job I've ever had. So um, I think my mentors affected me fairly profoundly, and they were willing to give me a job, so that was also good. But I learned from some giants in the field of surgery who taught me everything about what it's like to be an academic surgeon and what those values and commitments are. And it clearly had some effect on me. When I was a junior faculty member, Michael Edwards, was my partner. We were the surgical oncologists, and he was like my big brother in academic surgery, and we were constantly plotting what our next abstract we were going to submit, or grant, or paper, and those kind of things. And just having someone that is interested in the same thing and willing to help mentor you was profoundly important. And we drove each other to be better, I'm certain. At MD Anderson, I had great mentors with all the faculty there, and Charles Balch and Rafe Pollock and all the other faculty members. And each of them affected my career and my thoughts about how I wanted to approach it in a different way. But you get to see a lot of really, really smart and talented people along the way who teach you a lot of things if you pay attention.
Yes, sir. And you certainly have taught me many things as your fellow. So second question.
Some things you probably need to forget. Yeah.
The second question is, in your opinion, what makes a great mentor-mentee relationship thrive?
So there's nothing that academic surgeons like more than having a trainee who expresses an interest in becoming just like them. So once a resident declares that they want to be a surgical oncologist or a trauma surgeon or whatever it happens to be, the relationship changes, right? And then all of a sudden you're one of us, and we want you to be like us, and we want to teach you everything we can teach you to be successful. The lessons we learned the hard way, the things we did right, the things we did wrong, and provide advice, encouragement, opportunities. So there's got to be mutual interest and mutual respect, but I think having that enthusiasm about wanting to accomplish things and be successful, and willingness to work hard, that makes that relationship work. I've mentored people who, let's say in the laboratory occasionally were clearly not very interested in being in the laboratory, and that doesn't work very well. But that's not common, and certainly the mentor and mentee both have to do their part. But most people who engage in such a relationship, I think, get a lot out of it.
Yeah, so we try to start the SSAT mentor-mentee match, and I think this is our third year doing it. And so far, there's some successes and failures, and I think that you're right that some thrive and, some we need to work a little bit harder. So,
There needs to be mutual interest as well. That's why I think sometimes those kind of programs don't work. You can't just match up people who are, not in the same institution, don't have common interests. It becomes more of a burden than there has to be some self-interest, I think, on the part of the mentor, right? That they have reason to want this person to succeed because they come from their own program or because of some other reasons. But randomly matching people, I think, doesn't work very well.
right. Um, so now we're kind of switch gears and advise some training and job search. So, do you have any advice that you carried with you during your career for young residents and fellows and their job search and when they come to you for advice?
So, when you're a resident and when you're a fellow, you want to operate, do big cases, take care of sick people, and the thrill of that is, what drives you to work hard, and you're learning the whole time, and you may have interesting research questions that you're involved in answering, and those kind of things. But what I tell people is no matter what field of surgery you go into, the thrill of doing big cases and taking care of your own patients, doing your own operations wears off after a while. It's always thrilling. If you're a surgeon, I still love being in the operating room better than anywhere else, right? Push comes to shove, I'd rather be in the operating room. I got another Thursday, like you remember, tomorrow when I'll get to operate all day and kind of operate on a whole bunch of people, and that's the most enjoyable part of my week. But nevertheless, even though surgeons always love being surgeons and taking care of sick people and operating, you have to have some other aspect of your career that's going to make it rewarding, or that thrill of coming in and doing big cases becomes a burden. Then you think you have to be the busiest surgeon, do the most complicated, difficult cases, and then day after day after day, that in and of itself. Now, for some people, they can be rewarded by doing that as what they do for their whole career, and I would say for most people, one of the contributors to burnout, which is such a hot topic these days, is that you need a reason to want to wake up in the morning and come to work and be excited about it. When I first started early in my career, it was, hey, I have my own patients. I got big patients with bad cancers, and I get to operate on them and take care of them. And it was also, I come to work in my office and I have a blank computer screen and any number of ideas that I could think of that I can do research. It's a matter of identifying the right question. Whether so you need some other facet of your career or facets of your career that are going to keep you engaged and enthusiastic about being at work throughout the course of your career, and that will evolve and change. So that can include research, and certainly that's a great additional aspect that always keeps you engaged and working with young people and mentees who have better ideas and and are able to come up with new questions all the time. Education, if you go into academics, uh, we're all educators, and some of us are better at it than others. I'm still trying to learn to be as good of a teacher as the people who taught me. But I have to work at it some to try to become a better educator. But there's clearly a huge reward. You realize that after you've written a lot of papers, that how many people didn't read them, and and how many grants that you wrote that got rejected, and ideas that you had that turned out to be not good ideas. But at the end of the day, when you reflect back on the people you've trained, every resident, student, fellow that you interact with is an opportunity to make a difference, a lasting difference. And you don't recognize it. That I remember things that my mentors told me, and I still hear the voices in my head, comments and things. You don't know that that your residents and students and fellows are actually paying attention. You don't know which thing you say is going to stay with them for the rest of their life, or things you say, but they do. And um, education is a great way to enhance the quality of your work life if you become involved in training other people. And it's very rewarding when you see people like Young Hong go off to be very successful. I can't claim credit for most of that, but I can claim credit for a little piece of that. I'm very proud of you and what you're doing. Um, and some people, it's being involved in other things, in administration, and the medical school and the dean's office, in the hospital, serving in the hospital committees, the cancer center, the trauma center, the advocacy in national organizations, in the American College of Surgeons, serving in the American Board of Surgery, serving in various capacities in national, regional, and local organizations. Some people, advocacy. Some people, it's community or worldwide service and medical mission kind of activities, or service in underprivileged countries, or a combination of those things, or other things. But you have to diversify your work portfolio, like you do your financial portfolio, so that you have a number of interests and a number of things that will engage your interest throughout your career. That's the advice. The other piece of advice I tell people, if you have a family, my family didn't care what time I went to work in the morning. They only cared what time I came home at night. So that's why I have always accomplished more early in the morning before other people were awake than I did at any other time of the day, and tried to be sure that I, to the degree possible, would have some time for your family and friends. And the other thing I tell people, or I've started telling people because I never realized this or followed my own advice for many years, is something about work-life balance, a concept that didn't exist when I don't think when I came through training, or at least we didn't pay any attention to it. So work life was one thing; it was our work life. And so finding other interests outside of work that will give you joy and pleasure, and give you other things to be interested in. I think having some balance there is obviously very important.
Well, I think those are excellent pearls, and I still remember your advice that you gave in your back porch. So you are right. We do remember things very vividly, and we carry them with us, and that's kind of the things that you as a mentor make that I don't think sometimes we give you enough acknowledgement at times. But So, as a as an employer, as a chair, so to flip it around, what factors do you look for future faculty members? Just so you can give some fellows that are graduating this year some ideas of what chairs look for when they come talk to you for job.
So when we're recruiting academic surgeons, have to realize that the operative word is surgeon, and the noun is surgeon, the adjective is academic. And so, unless you're going to go into a position where your almost sole job is to do research, and there are very few of those kind of jobs these days in academic surgery, you have to be a good surgeon. You don't have to be the world's best surgeon. You don't have to be the busiest surgeon. But you have to be a good surgeon and a good doctor. Because no matter where you go, if you're not a good surgeon, you will not have the respect of the people you're training and your colleagues. And if you're not a good doctor and take good care of patients, so you won't. How are you going to teach people to do that and do it right if you don't try to do that yourself? So you have to devote the time and effort to becoming a skilled surgeon, to exercising and learning good judgment, and be self-critical enough that you can evaluate yourself and understand your shortcomings as well as your strengths. Failure to do so can sometimes be catastrophic, quite honestly. But at least in most departments of surgery, certainly in ours, we hire people. They need to be good surgeons. They're going to take care of patients and provide good clinical care, because that's going to be a big part of the job. Um, uh, we also Nobody wants problem personalities. So if you're the kind of person that can't get along with other people, that's a red flag. What do I look for? I look for people whose thermostat set just a little higher than everybody else, who want to teach and do research and have a passion for what they're doing, and are enthusiastic about taking care of surgical patients and teaching others the same. Uh, Sometimes in our department and every department, there's a role for those who really focus on being surgical educators, an important role, who maybe don't get grants and write as many papers, but clearly I don't think the idea of having a triple threat academic surgery faculty recruit is an outdated concept. People who want to ask and answer questions, who are curious, and whose curiosity is infectious to those around them. And often it's the simplest questions that no one else is, and most fundamental questions that no one else is really engaging in answering, that you can devise a strategy, whether it's bench research, clinical trial, some combination of translational research and clinical research, whether it's outcomes and health sciences, health services research, and other ways of answering questions. But I think it's important that people have that kind of curiosity where they want to be innovative and be involved in generating new knowledge and answering questions. And again, people who really enjoy teaching. Now, everybody isn't going to have all those qualities in equal measure, and the final component is making sure that the individual is someone who's going to be a good fit, who will be able to get along with people and with patients and referring doctors and with students and residents and others. But I think finding people like Young Hong who are hungry and enthusiastic and who can make everybody around them better, I think is what we're looking for. we didn't have a job for you, Young, but
Oh, thank you.
come talk to me someday. Yeah.
Yes, sir. I guess we'll move on to life lessons. Um, what are your unique challenges that you faced in your career, and how has it shaped you as a surgeon?
I don't think I've had any unique challenges in my career. Everybody has challenges, right? And life is not fair, and life is hard, and and everybody gets thrown hurdles and challenges that you have to get through. So I think how you deal with that um, to a large degree determines how successful you'll be.
And what are your fundamental principles that drove you to be so successful in your surgical career? You are just one of the living giants in surgery, and just for the audience, how can they become like you, I guess?
I don't know that anybody really wants to be like me, but um, when I look back, when I look at my career, and I mean, maybe from where you're sitting, you see something different, but I'm just doing my job, right? I just came to work every day, and it's like, why is there so much money in my retirement fund when I didn't know that I had it there? I came to work every day and I put a little bit of money in the bank, whether it was in the research bank or in the educational bank or the clinical care bank. I just came in and pitched in a little bit more every day, and thought that was what I was supposed to do. And all of it adds up and snowballs after a while. And you realize that you've got many people. I have many people around me who deserve all of the credit for anything that I've accomplished. But I get my name on a lot of things, and get to take credit for the work of a lot of other people in addition to any work that I've done. So I think if you enjoy what you do, if you are curious enough to ask some questions, and I tell people it's just as easy to answer an important question than it is to answer a trivial one, right? So if your strategy for doing research is to look and see what was presented at the meeting last year and write the same abstract and see if it gets submitted, that works a lot of the time. Don't get me wrong. And I know all the strategies for getting abstracts accepted and papers accepted. But why not think about why is it with this patient or that patient that uh, that it is that the way it is, or why can't this patient get better? Why did I have this outcome? Or whatever other questions you're answering, and be willing to adapt and evolve. I mean, uh, Young, who's an expert and trained, for 3 years at the NCI doing immunotherapy, immuno-oncology research. He knows my enthusiasm for immuno-oncology, even though I never learned any immunology. My research was all in the lab, was all in a completely different gene therapy area and melanoma biomarkers for my entire career. We just got a DoD grant. I'm the PI of an immuno oncology grant, Young.
Oh,
And I still don't know any more immunology than I knew before, but I know enough people that helped me to get that thing over the finish line. And we're moving in the right direction, and created a division of immunotherapy in the department. I've got seven PhDs that are doing great work. And why is all that? Why am I excited about that? At my age, they're and after all these years, I come to work and I'm thinking about immunology. Not that I know anything about it or I'm smart enough to have great ideas, but I have residents in the lab who are getting PhDs and in immunology, and other smart people who are all making each other better. And I had to just get the right people together and put them in the same place and try and stimulate them to to ask the right questions and help each other out and create an environment where people can be successful, challenge people to be successful. And if I've done anything right, it's um, it's do those kind of things where I try to find the young faculty members, fellows, and residents, and students, and people who are enthusiastic and hungry to succeed, and who are smarter than me, who I can encourage and support and provide opportunities for them to show how great they can be.
Well, that's amazing. I'm so happy for you that you got the DoD grant. That's amazing. Uh, I know I saw your immunology department on the news, so I knew that you were building something special there. So I'm really happy for you there. Um, and so I guess to conclude, I just want to say, besides your professional successes in American surgery, what is a fun fact that most people don't know about you? I know that looking through your CV, you were born in the hospital that I currently work at, so I thought that's a fun fact. And I know that you wrote your Sunbelt melanoma trial in the back of a napkin when you were brainstorming it originally. That's heard that rumor. So, what other fun facts do you have that people don't know about you, besides your
Uh,
cricket, backhand, and tennis?
Well, it was an honor for me to return to the hospital, to Cooper Hospital, the hospital of my birth, to give grand rounds a couple of years ago, and I hadn't been back since I was born. It'd been quite a while, but it was good to come back. It's changed quite a bit. I understand. It's an
Yeah.
amazing facility now. Um, so you've already mentioned, what do people don't, what do what other fun facts about me that I don't know? You mentioned I play tennis a few, 3 or 4 or 5 times a week, but that doesn't mean that I'm good at tennis. But I have to pay somebody to play with me. So, but I enjoy for exercise. I like to go hit something at the end of the day, and so I go hit tennis balls, and that often is a useful outlet for many things. And my other passion that I found in the last decade is farming. So while we have a farm, it's a couple hours away, as you know, that is perfectly far enough away from work, but close enough to drive 2 hours to get there. My cell phone doesn't work in the hills of central Kentucky. So, here's another piece of advice for you. Find something you can do and get this damn thing out of your hand, okay? Where you're not looking at it all the time. For me, I have to go somewhere where it doesn't work. But if I'm out on a tractor all day long, there's nothing that clears my mind, and it's like meditation on a tractor. You didn't know that, young. It completely changes your outlook on the world. So while hunting and fishing and all those other things are activities that I enjoy, but there's nothing I enjoy more than, now that all the corn is planted and the soybeans and the sunflowers, and now I can watch it grow. And for some reason and then I have to harvest it, which is a lot of work. But for some reason, that gives me incredible joy to watch this stuff grow. So now how everybody has these Ring cameras everywhere, and they
Yeah.
have them at the farm. I now have a corn cam and to watch the corn, and a bee cam where I can get on here and watch the bees in the beehive, etc. So that's longer of an answer than I know you ever wanted to hear about what other fun facts about me. You asked, so I answered.
Yes, sir. Well, yeah, that's I didn't know that even. So, okay, well, Dr. McMasters, on behalf of the SSAT Resident and Fellows Education Committee, I think we are indebted to your time and your insights and words of wisdom. And I personally will always be indebted to you for your mentorship and your guidance and your impact in my success and getting me a job here. And everything that you've done for me. So I think this interview is just a brief insight into the world of wisdom that you have, and I just hope that people come up to you and ask you more and talk to you at the meetings because I know you're someone that loves to give more advice and insight to young trainees like myself. So thank
Well,
you.
I hope that this interview doesn't discourage a whole generation of alimentary tract surgeons from entering academics, but for you, I agreed to share what I could. So thank you.
Well, thank you so much, and please send my best to Miss McMasters.
I sure will.
Thank you.
Best to your family as well.
Thank you, sir.